Well, welcome and thank you for joining this Common Sense Institute webinar today. Our topic is Proposition 118, a statewide paid family and medical leave insurance program. CSI has conducted a report on this, analyzing the cost associated with this program. Next slide. My name is Kristen Strom. I'm the president and CEO of Common Sense Institute. We are a nonpartisan, nonprofit, free enterprise research institute dedicated to the protection and promotion of Colorado's economy. I'd like to now share a short video with you that explains some of our work that we conduct.
A healthy, growing Colorado, built on a solid foundation, facts, bigger than bias, using the time-tested analytical tools to give the citizens the information they need. We are CSI, the Common Sense Institute, and our mission is to examine the fiscal impacts of policies and initiatives so that the laws that impact our lives allow individual opportunity to flourish, not skewed or bent by politics or partisanship. Our team includes some of the best and brightest policy minds in Colorado. And our board of directors from every corner of our state encompass all of Colorado's industries. We are committed to the protection and promotion of Colorado's economy. Because in our opinion, that's just common sense. We are the Common Sense Institute.
So for those of you that aren't familiar with Common Sense Institute and our work, thanks for joining us. We analyze and research topics that are moving through the legislative session or that might be on the ballot. As I mentioned before, one of those topics that we're going to be diving into today is Proposition 118. It's important to know that employers they've known that providing service programs like paid leave promotes retention and recruitment of employees. For decades, companies in the free market have developed their own programs, which in turn, in some cases, have created a competitive advantage for those companies. In conducting this report, CSI modeled the anticipated costs, both direct and some indirect, to implementing and running a government-mandated and run program, so that voters could better understand how the program would impact them. It is also important to note that CSI did not look at this from a gender perspective. So let's dive into the topic at hand. What is Proposition 118? Prop 118 would create a state-run paid leave insurance benefit program for Colorado. The program would include up to 90% wage replacement and cover up to 12 to 16 weeks of leave annually. And the leave ranges from bonding with a newborn to personal injury and combining benefits offered through separate programs of paid leave and short-term disability. Colorado's definition of family members when qualifying for paid leave includes any other significant personal bond that is or is like a family relationship, regardless of biological or legal definition. Perhaps something important to note, and Lisa, one of our fellows, will dive into this in a moment, is that compared to other states with existing state-run paid leave programs, Colorado's would have some of the most generous benefits in the nation. And this is a really important note to keep in mind. Next slide. So it's also important to recognize the history of paid leave proposals in recent years. In 2019, the state legislature in Colorado attempted to pass a similar version of Prop 118 called Senate Bill 188, which did differ slightly from this proposal. Estimates suggested that the agency would have required a premium rate of 0.64% of wages, which would have generated roughly $1 billion in revenue the first year. Premiums under Senate Bill 188 would have been split 60-40 between employees and employers, differing again from Prop 118. And that would have resulted in a $382 million increase in cost to businesses. CSI conducted a study on the economic impacts of Senate Bill 188, which I'll dive into the key findings momentarily. It was ultimately killed during session, but coming out of that legislative session in 2019, FAMLI task force, family task force, was created to come up with a paid leave solution. The result is that the group came up with 21 recommendations moving forward. It was the hopes that in 2020, the legislature would solve the paid family leave issue. However, the legislative leaders brought forward new legislation during the start of 2020 session that did not move forward. And instead, a national organization chose to put this question of establishing a paid leave benefit on Colorado before voters on the November 2020 ballot. And that is the form of Proposition 118, which we'll discuss today. Next slide. But before we dive into Proposition 118, it's important to take a minute to review the key findings of our previous work on this topic on Senate Bill 188. The main risk to this proposal centered around the utilization rate. That is, how many people will use this benefit. If the utilization rate in Colorado were to jump to 7%, which would still be 6% lower than the utilization rate of Rhode Island, it was probably found that there would be not enough funds in the program to pay out the benefits. In addition, we modeled some of the other costs. Direct costs to workers and businesses of about $2.6 billion by 2029, loss of jobs by 2029 around 14,000, and an economic loss of 1.5 billion GDP. Next slide. The two authors of the report today, Chris Brown and Lisa Strunk. These economists are the ones who conducted the research. I'd like to start first with Chris Brown. He's the Director of Policy and Research with the Common Sense Institute, where he leads our efforts, including conducting the study that I previously mentioned on Senate Bill 188. His goal is always to provide insightful, accurate, and actionable information on the implications of public policy issues throughout the state of Colorado. Prior to joining CSI in September of 2017, Chris spent close to a decade working for REMI, Regional Economic Models, Inc. In 2011, he established their Washington, D.C. office and oversaw the growth of the company in the nation's capital and led numerous engagements on both federal and regional policy issues. Lisa Strunk served as CSI Development Research Partners Fellow on this project. Lisa prepares all aspects of primary data research, including instrumental design, data collection, and analysis for specialized industry cluster research projects for various cities, counties, and customized geographic regions that highlight target industries for growth and retention. Previously, Lisa was a senior research analyst for the Colorado Health Institute, a statistical analyst at the Colorado Department of Healthcare Policy and Financing, and an economist in the Governor's Office, State Planning and Budgeting. We're really thrilled that Lisa was part of our team in this project today. Before I turn it over to Lisa, I'd like to mention that you can log any questions throughout the presentation in the Q&A feature down at the bottom of your screen. Lisa, I'll turn it over to you.
Hey, thank you so much, Kristen. To lay the foundation for the model, I want to first discuss the costs and benefits of the program and then get into the program specifics. I will then discuss the status of the paid family leave policies and programs in other states, and then I'll be turning it over to Chris to discuss the model results. Actually, you can go back to the previous slide. Okay. So here we've summarized some of the costs and benefits associated with a one-size-fits-all paid family leave proposal. Proponents of paid family leave have cited numerous benefits that include, but are not limited to, ensuring the economic security of workers, their families, and their employers through improved labor market attachment and higher wages, increased long-term labor force participation for caregivers, improved job retention for both low and high-paid workers, higher employee morale and reduced employee stress, and also decreased need for public assistance programs. Several studies have cited that offering paid family leave improves business productivity by boosting employee morale and making it easier for businesses to retain skilled workers. A central concern among opponents of government-mandated paid family leave is the costs imposed on employers. Even if employers do not have the fund the leave, they could face indirect costs from the need to hire replacement workers, coordinate employee schedules, or reassign work tasks. Alternatively, employers could experience cost savings if workers would have otherwise quit, instead returned to their jobs and reduced turnover rates. Some of the other major costs associated with paid family leave include the cost of hiring a temp to cover the person while he or she is on leave, a potential decrease in productivity to the fact that other team members may need to cover for that person, and the cost of covering full benefits for the employee while he or she is out working. While paid family leave programs may prevent some level of lower turnover overall, the costs associated with hiring and training a temporary worker, along with their direct pay, present higher burdens for some industries, such as restaurants, while presenting less of a burden for other industries, such as professional business services. A concern among businesses are their ability to remain profitable while replacing employee wages. Opponents of paid family leave argue that costs could be high for businesses operating on thin profit margins. Firms that have thin profit margins and higher labor costs will most likely experience a larger impact on their bottom lines than firms that have wider profit margins. The one-size-fits-all policy could disproportionately impact small businesses since they have smaller profit margins compared to large firms. Some could lay off employees or cut hours, wages, or benefits. Some firms may be forced to close entirely, unable to afford the expenses that accompany a government mandate. It is important to recognize here that yes, there are these benefits and costs that might be harder to quantify, but we really built this around the ability to model the direct and indirect costs of this program. Next slide. So I want to talk a little bit about the program specifics then. So to pay for the program, a new premium would be imposed on all Colorado payroll, excluding federal workers. Employers and employees would share the cost 50-50. The revenue generated by the premium would be used to administer the new enterprise and to pay paid leave benefit claims. Nearly all workers in Colorado, an estimated 85%, would be automatically covered and required to pay their share of the payroll premium. Local governments may opt out of the program. Self-employed individuals must elect to pay into the fund for at least 3 years prior to being eligible to take paid leave. State government workers are automatically enrolled, but federal government employees are exempt. Each employee who elects to utilize the paid leave program will have their wages replaced based on a progressive formula. The wage replacement formula is set to a progressive scale as lower wage workers receive a higher wage replacement rate. The weekly benefit is capped at $1,100 per week at the start of the program. The wage premium is set according to a formula established in the statute. The wage premium starts at 0.9% of wages for the calendar year of 2023 and 2024, and then can adjust based on program demand thereafter in order to remain solvent up to 1.2%. Okay, next slide. Okay. This map shows the status of paid family leave policies and programs across the nation. Most states at this point have adopted or considered paid family leave. In 5 states, Colorado, Maine, Vermont, New Hampshire, and North Dakota, paid family leave legislation was recently considered but ultimately failed for reasons that range from concerns over funding or mandatory participation to the, or lack of bipartisan support. California, as I've noted on that slide with a red star, was the first state to enact legislation in 2004, followed by New Jersey in 2009 and Rhode Island in 2014. Also, New York passed this in 2018. These states also manage 2 separate paid leave benefit programs based on the 2 different types of claims. One related to temporary disability and personal sickness or injury, and a second related to caregiving claims, either for childbirth or for supportive care for family members. In California, New Jersey, Rhode Island, and New York, paid family leave programs build upon existing short-term disability programs offered by or required by the state. Through each of the state's eligibility and benefits premiums, they differ between the TDI and family leave programs that cover caregivers. It is important to note here that temporary disability is a bigger cost and major component of those programs. Other states to recently pass legislation include Washington and the District of Columbia, with benefits beginning in 2020. Massachusetts, Connecticut, and Oregon also recently passed family leave benefits starting in 2021, 2022, and 2023, respectively. At least 16 other states have introduced similar legislation. Given that the types of qualifying leave under Proposition 118 essentially combines these two types of paid leave programs under a single program, it is important to note, to compare both programs from other states to the proposed single program in Colorado. Since several of these states recently passed legislation that have not yet gone into effect or went into effect earlier this year, many do not yet have annual financial data available to evaluate their finance performance. Okay, next slide. This chart summarizes how the states have enacted paid family leave and how we can compare and contrast those. Several of these states are similar in that they provide some form of partial wage replacement during paid family leave. However, they differ in their duration, funding mechanism, benefit amount, job protection, and what constitutes a qualifying event. While these programs are comparable in some ways, the program proposed under Proposition 118 stands out as offering a greater level of benefit across several areas. Similar to Hawaii, Washington, and Washington, D.C., Colorado will offer a 90% wage replacement. On par with Washington, Colorado will offer a similar length of leave in terms of weeks. Next slide. This chart, we are examining the wage replacement rate compared to other states. On the x-axis, we have the annual wage, and on the y-axis is the wage replacement rate. Basically, this chart is saying that the wage replacement rate is higher for those lower wage workers and then decreases as the average annual wage rises. The wage replacement rate proposed under Proposition 118 would be substantially higher in Colorado than in California, New Jersey, and Rhode Island, starting at 90%. As a major determinant for taking leave is whether or not the individual can afford to forego their normal wages. Thus, the higher the level of the wage replacement, the higher the probability someone would be interested in taking leave. We are using these three states as a point of reference since they are more established programs that have annual utilization rate data available. Newly established paid leave programs such as in Washington State and DC do not have this data as of yet. Next slide. To understand the economic and fiscal ramifications of Proposition 118, CSI constructed a model to represent the different financial aspects of the program for the first 7 years of collecting premiums, so 2023 through 2029. Essentially, what we are trying to do here is to analyze a more robust range of direct and indirect costs associated with the potential implementation of Proposition 118. While there are undoubtedly benefits to both workers and employees related to those benefits, it is critical that voters fully recognize the potential costs, as those costs, both direct and indirect, are often likely the reason employers don't currently offer the same level of benefit. This model is based on a model developed by the Colorado Department of Labor and Employment in response to legislative policy debates in 2019. However, it is updated to reflect the program details of Proposition 118 and to include the most recent economic data and demographic projections. The model is constructed to estimate annual benefit payments, administrative costs, and required contribution amounts for both employers and employees based on several underlying factors. Many factors are related to the specifics of Proposition 118, including maximum length of leave, wage replacement formula, cap and weekly benefits, and maximum level of income used for contributions. CSI will have components of the model in order to run through some sensitivity analysis and testing assumptions on their website. And Chris will talk about this a little bit later in the presentation. Okay, next slide. This model gives us a way to test program alternatives and to be able to determine the elements of the program which may prove to be most impactful. A thorough sensitivity analysis and scenario testing of the model revealed that of the model inputs, the degree to which the program is utilized or who's using the program, including the combination of claims rate and average length of leave, ultimately impacts the degree to which the program is more or less affordable. And given the fact that the proposition language includes a premium cap of 1.2% of wages, the alternatives also show the degree to which the program can remain solvent. Based upon expert recommendations provided by the Colorado Task Force in 2019, an analysis of existing programs, a broader range of potential program utilization levels were assumed. Next slide. Based on claims rate and average length of leave for the DU study that we looked at and that had been published prior to this, and other states with established programs in California, New Jersey, and Rhode Island, CSI derived the following scenarios given likely claims rate, average length of leave, and administrative costs. The range of key cost drivers are shown in the table. I want to talk through these scenarios in a little bit more detail. So first I want to start with the low scenario there. So the claims rate of 5% reflects the lower bound of the suggested range provided by the DU study in their report to the Colorado Family Leave Task Force. The same DU report also showed that the simple average for the average weeks of leave across the 3 states in 2017 was 8.9. We rounded this value to 9 as the lower range, as no other state experience had an average length of leave at this lower level. While the DU study estimated administrative costs to be just 3% of benefits, this was much lower than several other reports provided to the task force. While AMI estimated an expense ratio of 7%, Pinnacle estimated a 10% rate. So we assumed 6% at this lower end estimate. For the middle scenario, we have a claims rate of 7%. Given this was the higher value reported in the DU study, the lower end assumed claims rate in the task force report was estimated to be 6.9%. In terms of the average weeks of leave, we estimated this at 10 weeks of leave as our middle value, as kind of the midpoint between that higher value and lower value there in the table. An administrative cost of 8% for this scenario was assumed as a value between the high value of 10.6 and the low value of 6%. In our higher scenario there, since the benefits proposed in Proposition 118 is greater than other existing programs with a history of claims, it is very likely that the level of claims will be higher than in other states, particularly for paid leave claims related to caregiving. While it is possible that the claims rate could be higher, 9% was assumed for the higher range estimate. For the average weeks of leave, the weighted average across for the average weeks of leave for California, Rhode Island, and New Jersey was estimated to be 11.4 weeks. Given California and New Jersey have recently expanded their benefits, it is likely those estimates will increase in future years. However, given the cap in the number of weeks of leave of 12 under Proposition 118, 11.5 was assumed as an appropriate upper bound estimate. The upper bound of administrative costs was estimated at 10.6%, yet it is likely that the cost could escalate to this level and beyond. The 10.6% was assumed given this is the ratio of administrative expenses for Colorado's unemployment insurance benefit program. Given this program is already managed under the Colorado Department of Labor and Employment, the same department where paid leave would be managed, this appeared to be a reasonable comparison. We estimated the cost based on the total appropriation to the UI program in the 2019 long bill, divided by the total benefit cost for 2019. I also want to note here that the administrative costs of the UI program jumped to 14% in the current long bill. However, given those are being influenced by COVID-19 related spending, it's too early to tell if those additional costs will be permanent.
Lisa, let me jump in real quick because we have one question related to administrative costs.
Sure.
Our question is, are these for the state or for employers? What defines the administrative costs?
So the administrative costs, let me look at my, I just want to pull up my exact definitions so that I don't misspeak on the components here. So the administrative costs are set at 40 million. Essentially these would be all of the when setting up the initial IT program in the system. It would be managing the claims. It would be all of the basic, kind of duties that are associated with managing the program under the Colorado Department of Labor and Employment.
Great. So they're costs that the state would have.
Yeah.
Okay, great. Thank you.
Sorry about that. Okay. And I will now turn this over to Chris, and he's going to walk us through the various model results.
Okay, perfect. Yeah, thank you, Lisa. For the sake of being a little repetitive, I just want to, reiterate a couple things that I'll be walking through the model results across a range of outcomes, including employee costs, employer costs, and solvency. All of the results that I'll show here are also included in our report released this morning, so you can thumb through or scroll through as I'm talking, or I'll give you a little bit of a sense of what the results look like here, and hope that, and give you the opportunity to go through the report in more depth and more detail. But, as Lisa described, and as we've talked about in these programs previously, the level of utilization, the degree to which these programs are used, influences the cost. This is an insurance program, and similar to the way healthcare or car insurance is paid based upon the level and value of claims. And this matters, we can see here, in California, just 2 years ago, they had a claims rate of 4.7%, and fast forward 2 years, and their claims rate has jumped to 5.4%, or a 15% increase, again, just in 2 years. So that will influence, that ultimately influences the premium and the price that's paid. Next slide, please. You can keep going. So I want to introduce you to this slide as it's something that we put in the paper a couple different occasions, and I'll show you here in 2 different variations. But this shows how the premium, how the payroll or the wage premium responds to the level of utilization. So on the vertical axis, we have the premium rate. On the x-axis, we have the average weeks of leave per claim. And each line reflects an alternative claims rate, so ranging between 5 and 9%. And you can see that for each line, for each claims rate, as the average weeks of leave, the average length of each claim increases, the premium required to cover those benefits and the administrative costs ultimately increases along with it. So if we go to the next slide, from the report that we mentioned that was submitted to the FAMLI task force, the low end of claims rate and average weeks of leave fell at 5% claims rate and about 9 weeks for the average length of leave, showing a premium required to fund those benefits at just around 0.7%. The upper end in that report required a premium rate of closer to 1.3%, above the 1.2% cap, I should note, of the Proposition 118 proposal. Then if we move to the next slide, these reflect the 3 ranges that we settled on within our report, and that the next series of results I'll go through ultimately reflect, showing a low, middle, and higher end, again, that Lisa described in our reasoning for where each of these degrees of utilization fell based upon other programs' experience and the degree to which we would expect Colorado's program to see likely a higher level of utilization. You can see that somewhere between our middle range and our high range, ultimately the program would face solvency concerns and would start to hit that cap in terms of what the premium cap could support, ultimately triggering further legislative action. So again, now let me walk you through some of the results across the different levels of outcomes across employees, employers, and solvency. So move to the next slide. So this shows you the impacts at a high level on the program overall. And apologies, you may have to just click through these. We have different items that click. So the premium rate, if we start with the premium rate, on the low end, again, reflects what you saw in that chart from a premium of 0.7 to 1.7. And I should note here, just for clarification, we built the model to reflect two different possible outcomes. The outcome I'm showing you now is this uncapped idea, where if the benefits and the costs rise past the level that the 1.2% cap can support, the legislature would have to change statute to increase the cap, and we would see the cap, the premium actually rise to just fund those benefits. I think a very important note and concept to understand within this program is that there is no mechanism in the legislation to reduce the size of the benefits, to reduce the level of the benefits, again, in the event that the costs rise above what the premium can support. When we test the solvency, we actually run the model in a capped scenario where we assume the premium remains fixed at 1.2% and actually can't go beyond. But you'll see here in these scenarios, we allow the model to actually increase the premium if required. So the premium rate range, if we move forward to the premiums collected, we can see that the range here for premiums collected, and again, this is showing 2028. This is 5 years into the program when we would expect the level of utilization and the program financials to maybe level off and be less volatile. But the range here of total premiums collected in terms of the overall revenue, if you will, going to this program would be between $1.3 billion and $3.1 billion. The employee share of those premiums ranges from $740 million to $1.7 billion. The employer share is between $580 million to $1.4 billion. And then the total benefit payments, which reflect the collections minus the administrative costs, of between $1.1, $1.2 billion and $2.6 billion. So we can cycle through this. One more, might get you there. Perfect, thank you. So, and then you click one more time. As we look at the impacts on individual employees, what we've set up is the ability to look across a wage scale on the left and compare against the current state's flat income tax. So in our scenarios, ranging from a premium of 0.71 to 1.7, we can see that the annual employee share of the premium ranges from an 8 to 18% relative increase in income-based taxes, wage-based taxes on that income, relative, again, to the state's existing income tax. So for $50,000 in wages, if your wage is $50,000, you would pay an annual premium of $178 to $425, again, depending on where the premium is set, depending on the level of utilization. Okay, next slide. When we run the model in this capped framework, so we don't allow the model to increase the premium, we can test the solvency and the degree to which, under our scenarios, the level of contributions is not sufficient to cover the anticipated level of benefits in the following year. Maybe a little bit of nuance, but the way that the premium is set is based upon the benefits and the costs in the current year, and then used to fund the benefit payments in the following year. So these numbers reflect the difference in benefit payments in the current year minus the contributions in the previous year. And we can see that in our middle scenario, we anticipate, or you would see when the premium is capped at 0.9% prior to 2026 when the, prior to 2025 when the premium can rise to 1.2, we actually see some issues, some concerns with solvency. In our high scenario, each of the years ultimately requires a premium level beyond what the program as it's currently written can sustain. Next slide, please. So a couple points of interest, just to maybe put a finer point on this concept. In the start of the program, when the premium is set for the first 2 years at 0.9%, if there is a claims rate above 6.2% and an average length of leave above 9.5 weeks, then the contributions are not sufficient to cover the benefits. After the first 2 years, when the premium can rise to that 1.2% level, then the claims rate can jump to 7.5% with an average length of leave of 10.2 weeks before the program faces, again, these solvency concerns. Next slide, please. From an employer standpoint, there's a lot of different ways to slice this, but one way to look at the level of contributions required of employers as a result of this program is in our middle scenario in 2025, the required premium would increase employer contributions, or would require employer contributions of $1.34 billion, which relative to the existing corporate income tax is an over 200% increase in the existing corporate income tax collections. Next slide, please. So it's not just about the direct costs. We also have come up with a couple different ways to build some scenarios for different types of employers based upon whether or not they want to offer higher level of benefits, whether or not they must cover the expense of replacing workers who take leave. And we can see that, again, the challenges of a one-size-fits-all model, when you have, let's say, a restaurant with 30 employees, a low margin, the impact, and that has to replace 100% of the individuals on leave, it reduces, this program would ultimately reduce, in our middle scenario, reduce their margin by 13%, cost about $212 per employee. On the other hand, we call it our biotech research related company. It has 200 employees and wants to actually increase the benefit level so that their employees who are paid a higher wage see only 50% of their wages replaced, yet they want to offer a benefit beyond this, say up to 100%. They only need to replace 50% of their workers as they can shuffle some of the demands of each job. So they need to replace 50% of their workers, and they have a healthier margin of 15%. Their margin is not hit nearly as hard. They pay about $545 in additional costs, net costs per employee. But you can see that both of these types of firms are impacted very differently. And just to note that in both of these scenarios, the benefit payments to their employees taking leave is assumed to be a cost savings. And not just the level of benefit, but the full wage for the length of leave is assumed to be a benefit. So when I say net cost, it includes the direct savings from the benefit payments of this program for their employees taking leave. Okay, final slide, I think. So overall, we've talked about several concepts, but I think, and I encourage you to go back through our report. As Lisa said, we will be putting our model on our website that allow you to go in and actually modify some of these assumptions and test alternatives and see how this program will actually impact you and maybe interpret how it might impact your business. But and again, encourage you to go through our report as well and look at these tables in more depth. But overall, we wanted to leave you with the concept that the Proposition 118, as it's laid out, includes a higher level of benefits for employees when they take leave. That ultimately influences the cost of the program through the premium rate, and the premium does not have a direct mechanism to be, the cost does not have, there's no mechanism to reduce benefits, to mediate against the potential for the rising costs. And so while insolvency is less of a risk from the standpoint that the legislature is likely to be able to raise the cap in the premium, the new enterprise has the ability to issue debt in the form of revenue bonds to cover short-term cash issues. So while insolvency is less of a risk, the cost, the risk of a growing and escalating cost is more significant. And so our hope in showing voters, showing business leaders the estimates here is you can weigh the benefits as Lisa outlined with a more sort of robust understanding of the potential costs. So I would be happy to answer questions, and I'll kick it back over to you, Kristen. Thank you.
Great, thanks, Chris. If you do have any questions, please log them in the chat function or the Q&A box. We do have a few to kick it off. One question, can you talk a little about the option for employers to self-insure or obtain a private plan that is mentioned in the measure? Was this taken into account in the solvency outline you provided? Chris?
Yeah, absolutely. Yeah, so, some of these details will obviously have to be worked out by the regulatory agency if this passes, but the main point of this seems to be that employers will have the ability to opt out of contributing to this program and cover their employees through their own, whether it's some other form of insurance or self-funded, if they can meet the requirements, if they can provide a level of benefit or level of leave which is equivalent to or greater than what the benefits are spelled out in Proposition 118. So if you can meet that threshold, again, under the proposition, theoretically, the employer would be able to opt out. Both the employee and the employer would no longer pay the premium and then would cover those level of benefits themselves. But again, you would have to meet, and that includes exactly the type of coverage that's included. That includes including the definition of family. That includes the length of leave. That includes and as was pointed out, this is not just really a paid family leave program. This is really a paid family leave and short-term disability. So as this program encompasses a wider range of benefits. So if the employer wants to opt out, they must meet that minimum, the threshold of providing the benefits, at least inclusive of what's included in Proposition 118.
Lisa, did you have anything to add to that?
No, that's good. I was just going to see if we also might want to mention the recent bill that was also passed for Senate Bill the 205, which is the sick leave mandate. I don't know if we want to mention anything about that also, kind of to tack onto that. If you wanted to mention that, I can talk about it.
Yeah, that's great. I think, we do address that in the report, and it's a really good point, Lisa, that this last legislative session, some other bills were passed that could also impact this. So Lisa, do you want to touch on that quickly?
Sure. So back in May, the Colorado legislature passed Senate Bill 205, and that requires employers to cover 100% of their employees' wages for up to 48 hours of sick leave within a 12-month period. And so, you know, we looked at in the report this kind of interaction between Proposition 118 and the Senate bill. And Proposition 118, when you read the bill, what it says in there is that all other leave must be exhausted prior to being required to take the benefit through the new paid leave program. So unless under certain circumstances related to short-term disability insurance, under no circumstances shall an employee be required to use or exhaust any accrued vacation leave, sick leave, or other paid time off prior to or while receiving family and medical leave insurance benefits. So I think that that's an important point, that there are other bills out there that can interact or interfere, however you look at it, with Proposition 118. So we did take a look at that measure in the paper as well. So if you want more information, take a look at that.
Yeah, I think that's a critical point. And if I can, we have another question that looks like related to the opt-out as well. Maybe to put maybe add a little bit to that response. In the model, we assumed that 10% of employers or employees would be opted out through this provision. So we had a 10% assumption. We tested some alternatives with that, and we left it at 10%. I think one note to make on the dynamic there is that we did not go as far in making in our modeling, but you might expect that higher wage or larger companies with potentially higher paying jobs might be more likely to self-fund or be able to opt out. And that would have an impact on the dynamic of the level of wage base that's paying in and the level of the type of employees and their wages that are taking leave. So there might be a really interesting concern and dynamic with depending on which type of firms actually opt in or opt out. And I think that's worth discussion, but for our purposes, we left the opt out at 10%.
Okay, Chris, following up on that, the audience member also asks, are you aware of any existing employer plans that would be comparable to this state option plan?
Well, I think, along with that question is, what is the audit compliance, requirements? And I think that would fall both on costs to the employer, but also largely on additional costs from an administrative standpoint for the state to do that sort of auditing of whether or not the paid leave benefit program. So I'm sure that some employers, offer these level of benefits and beyond. So to some degree, absolutely, these types of benefit plans are currently offered in some form that are larger than this. However, again, given all of the specific details of this provision, as I said, including the types of leave that are covered, there's a lot of nuance there. The definitions for family when taking caregiving related leave are very specific and broader than, let's say, than the federal FMLA Act. So there are some nuances to this that I think employers that are concerned or interested in this are going to have to investigate to what degree whatever they currently offer not just aligns with the length of leave, but really those definitions and those other qualification factors. So I think those costs will fall both on employers and the state from a regulatory standpoint.
Okay, next question. Dynamic modeling like that espoused by the CBO would imply a significant amount of macroeconomic growth and higher household incomes. Could the higher incomes and additional sales taxes generated from the spending of the leave benefit offset the cost of the program? Lisa did answer this one, but Chris, I don't know if you'd want to add to it as well.
Yeah, I mean, I'll let you, Lisa, cover this as well. Yeah, I think one of the biggest challenges in understanding the um, the impacts we would see out of this from a dynamic standpoint is really having a strong understanding of where the level of benefits currently stand relative to where this program would establish them. So when you want to understand, okay, what's the impact from a macro standpoint, and how would this impact in addition to the baseline, we need to understand what those current benefits are. And the reality is that while a more limited number of people have, let's say, paid leave as defined in this program, there are a wide range of benefits offered to employees through existing sick leave and personal leave, other paid leave programs, other short-term disability programs. And so, you'd have to really evaluate that against the current baseline and to really recognize how many additional people would get how much additional leave. So there are undoubtedly those benefits, but for this paper we did not, really investigate that point.
Lisa, do you want to add anything to that?
I just my response to that is that yes, it could potentially offset some of it, but again, like you said, we didn't really explore those in that kind of detail. So I think that it's possible for sure, but we didn't go into that kind of analysis.
Okay, 2 more questions and then we will end on time, I believe, which is great news. One question, again, related to Senate Bill 205. Are employers required to fund that leave and then this benefit will kick in?
Could you, sorry, I don't see that in front of me. Maybe put a finer point on that.
So talking again about the bill that was passed at the end of the 2020 legislative session and how it
I see. I'm sorry.
relates.
Right. So starting in, I believe it's 2023.
It's 22 or 2022, I think.
2022, excuse me. All employees, so therefore all employers will be required to cover 40 hours of sick leave, 100% of the sick leave. That's not an insurance program. There's no premiums to that. That's just a requirement, a mandate to cover the sick leave for all employees. And so, the Proposition 118 says you cannot require an employee to use other benefits concurrently or to use other benefits prior to taking the paid leave. So ultimately, there is the employer cost related to funding 100% of the sick leave on top of the benefits of Proposition 118, I think is the concept there.
Lisa, anything to add to that?
No, I think, yeah, that's a good answer.
Okay, and then one last question as well. Is there any coordination with current federal FMLA coverages? Lisa, do you want to take a stab at that one?
That one, I think, can I throw that over to Chris?
Sure.
Yeah, no, the definition, the main difference is when you're taking caregiving leave, when you're taking leave to bond with a child or to help a family member, FMLA, the federal law which allows for leave to be taken and some worker protection, it's not a paid leave program, but it's a protection program that your job is secured for taking some of this type of leave. For not every employee is covered, but the definition for family and the family member is spelled out and is more limited, whereas the relationship in Proposition 118 sort of extends beyond, let's say, your immediate family to those who have, the exact wording is, family-like bond with. So again, it simply points to the extent to which we might see a wider range of use as a result of a broader definition of what would qualify for leave.
Great. Well, thank you, Chris and Lisa. We're going to wrap it up right now. If you can go to the next slide. Really thank you all for joining us. We do have a few upcoming events that I just want to draw to your attention to. Next Thursday, September 17th, we will be having a virtual webinar, our Eggs in the Economy quarterly event. We will be examining all of the different ballot initiatives that might impact you and their fiscal implications, from the fees proposition, paid family leave, the Gallagher Amendment, so forth. So please register for that. Details can be found on our website, commonsenseinstituteco.org. In addition, if you'd like even more information on paid family leave and Proposition 118, tune into our Common Sense Digest podcast. You can catch podcast episodes on all podcatcher platforms, including Apple. I'd encourage you to tune into that as well. Thank you so much, Chris and Lisa. It's been a pleasure discussing this important topic with you both. Have a great day.
Thank you.
Thank you.